Hi, I'm Monette Luke, Star Herald Digital News Editor. This week for our latest episode of Table Talk, we are visiting with Scottsbluff County Public Health Director Paulette Schnell. Thanks for joining us, Paulette.
Glad to be here.
The Panhandle has seen a surge in coronavirus cases, and Paulette is going to talk to us about the topic. So Paulette, can we start with a little bit of background about you and how long you've been in public health?
Yeah, so I'm going to age myself here, but I've been a nurse for almost 40 years, and with that, I've been in public health 35 of those years.
Oh, wow.
So I've been at it for a while, and this is something that we have talked about before and prepared for when it came to a pandemic. H1N1, I was there when we went through that, but nothing compares to where we are now, and I think we never really expected ourselves to get to the place where we are now.
Yeah, that was going to be one of my questions. I knew you'd been around for H1N1 pandemic, but that wasn't at all on the scale of the coronavirus. Lots more cases, higher death rate. Is that right?
Right. And it's just much more contagious. It's much more deadlier than the H1N1 was, and we also didn't do the quarantining and the contact tracing to the extent that we're doing with this, which is a lot of what public health is doing right now, and is very challenging to get done.
And would that have been because the spread wasn't as
right? It was
large, I guess.
Yeah, it didn't spread as long, and then the quarantine period wasn't what we looked at. It was talking more like the average flu of a 3 to 5 day period.
Oh.
So contact tracing really wasn't something that worked very well. It was more prevention by staying. Kind of the things that we talk about doing with this.
Right.
But the quarantine part wasn't really applicable because of the short incubation period.
Okay. So can you talk to us about the recent surge in COVID cases? It seems like each briefing you guys have more and more cases that you're reporting.
Right.
So if you could talk to us about what we're seeing in the Panhandle.
Yeah. We talk about how long it takes to double the amount of cases we have. And we went from March till into October before we saw where we could actually say we doubled the amount we had. And now we're doing that every 15 days is about the average that we're seeing. So when we talked about having, the cases that we have now of around 1,600 in the Panhandle, our fear is that that's going to double in 15 days and we're going to be looking at over 3,000 if we follow the same pattern. So if we don't do something to change that around, that's what we're going to see every 15 days is more and more where we're actually doubling the amount of cases.
And this week we did move into the severe level of the risk dial. For those who don't really understand what that means, can you explain that severe risk level and what maybe extra precautions they should be taking?
Yes, so across the state, the health departments came up with a dial to kind of help people be informed about where we're at with the risk. And we start off in green, yellow, orange, and red. And we've been in orange for quite a while. And this week we did creep up to the red. 3 to 4 is the range for red, and we were at like 3.1. So we're not high in the red, but that we're in the red at all is something that we'd hope that we'd never get to. Because with red, it basically means it's so severe that we have a large amount of community spread, a large challenge with hospitalizations, and the hospitals meeting those challenges. It's really pushing the resources of everybody to meet the need, and it's very challenging across the health system, from doctor's office to public health to hospitals. We're all being challenged. Resources are still there, but we don't want to get to a place where there is no resources.
Right. You see a lot of misinformation on social media about COVID-19, including one that it is just the flu. Can you talk to us about that? Why that comparison is incorrect?
This is much more deadlier and much more contagious because, one, it is a new virus. So the flu is around every year and it mutates a little bit, and that's why we have to have a different flu shot each year. But a lot of us have some basic resistance to some of the kinds that have been out there. This is a brand new virus that our bodies have not seen, so people are much more prone to it. And we don't have that resistance. We don't have a vaccine yet like we do for the flu, so that's the other tool in our toolbox we have for flu. Plus we have antivirals and several other things that we have for flu that we don't have for COVID yet. We're working on them. There's getting to be medications to treat, and the vaccine is hopefully coming soon. But until then, we really don't have the defense other than those measures that we can do personally and as a community to stop the spread.
There's even been some discussion about herd immunity, which Senator Groney did contract COVID-19, but said that it was his dream, or some statement such as that. Can you talk to me about why it matters that you contract COVID? Because there are some serious long-term health effects that can go with it, and then why herd immunity isn't really an answer according to the CDC.
You know, with herd immunity, it's never really been reached on the different diseases that we talk about without vaccine to help get there. And right now, we are seeing cases when you go past the 90 days that CDC talks about, where if you test positive, there's 90 days where we don't quarantine if you're exposed. You don't have to go into isolation if you, are exposed, those kinds of things. So past that, though, we are seeing cases here where people are reinfected. The unknown about this virus is what makes it hard to say, that herd immunity would really work and that you have a lifetime immunity, because what we're seeing doesn't really bear that out. I think that there are going to be lots of studies that will, be able to give us more clues as we move into this more. But right now we are seeing people who go past the 90 days, that had it early on in the seasons of March, April, May, and they are getting reinfected now. And we see that here. It's not just, some study out there. We are seeing that here.
And some people are having long-term health effects too. I've heard of some people they're still really struggling with fatigue a couple months later. They're struggling with some breathing and heart issues. Are you seeing that, or is that?
Yeah, because we talk a lot about death rate, and we are definitely seeing an uptake in deaths here in the Panhandle also. But they want to compare that to flu. But the thing is, those people that survive, which is most, do survive COVID, but it's a long haul if it affects you badly.
Yeah.
And we still don't even know the long-term effects of all of it. We've seen some teenagers who are having some long-term effects different than what adults do. There's adults that are healthy or out and about, have those maybe common chronic diseases like maybe diabetes or some heart problems, hypertension, those things, and they're out and about though, very, very active lives, and getting this, and it really knocks them out, and you end up in the hospital for a long period of recovery. And then just because we call you recovered doesn't mean that you're recovered after so long. People are having that long-term effects of just, it takes weeks to months maybe to recover the fatigue. We hear a lot of people talking about their neurological problems of maybe not really being able to focus, to be clear-headed about some things, just those basic things that take a while for it to clear out. Yeah. And then there's those side effects that we're learning about that don't just go away even with time, that they're affecting heart or some of the other organs, where we just, we don't know enough about it yet to know some of those long-term effects.
Yeah, it kind of reminds me of West Nile when it first started going around, and then you hear more and more of people who had contracted it and then they were suffering lifelong health effects that weren't expected in those first, that first summer that West Nile was really going around.
I know it's frustrating to people because they want to answer and they want clear cut, that this isn't a big thing or it isn't a big thing. And the thing is about this virus is we don't know enough about it, but we do know that it hits very differently with different people. Yeah. And it's not just the elderly that can get severely ill. And so it's one of those things, it's a gamble if you do get it, that it will just turn out fine, and most do. And it's the ones that don't that we're concerned about, and protecting those that we can.
Right. And that's probably the key about all of it, is if it's preventable. So you can prevent that it may impact you or I seriously. So what is that chief concern about COVID-19 spread? It seems to be mostly that concern is about that you can prevent the spread in the people, among people around you, and we don't know how it will affect them.
Right. So, right now, everywhere we're looking at, when it comes to the health system, it's being challenged. And in our community, we're, like I talked about, doubling every 15 days right now with cases. And we as a community and as individuals can help change that around before it gets to the point where it's past challenging. And those are the things that we're really wanting people to consider now. And so we have a campaign. We talk about the 3 C's. And we talk about, the governor promoted this also. And we talk about being avoiding crowds, close contacts, and confined spaces. So when you listen to that, you think, okay, how does that apply to me? How does that look in my daily life? And we really talk about, okay, the crowds, think about that. Are you going to be going somewhere where there's a crowd?
Right.
And that could be to church, that could be to your workplace, that could be to an optional social event that you're choosing to go to. Mm-hmm. Is it something that you have to go to? Is it something that a large group of people should be getting together for? And sometimes you have to go. If it's your work, you have to go. You know, if you can't think of, those kinds of places, or, there's just certain things where you need to go. So when you do go, think about how you can make it the safest as you can. Wearing masks. I know a lot of people are very tired of hearing about it, but that is one of the simpler things we can do, washing your hands. And then if you do feel sick, staying home and getting tested, and testing availability, we're expanding those in the community, but it is a challenge sometimes to have to wait to get tested. But those are the things, even just staying home and seeing what, how you do, because some people may think a scratchy throat and a cough is nothing but allergies, and it turns out being COVID. And so just taking those steps as much as you can when you do have to go out in a crowd or be in a confined space. And then the other thing is thinking about who are your close contacts. So you have kind of this bubble of people that you're around all the time, and it's your family members that you're with, those kinds of things. But thinking about close contacts, that go past that, and trying to limit those as much as you can. If you're going to be around people, wearing the mask again, keeping the 6 feet apart, washing your hands, trying to apply all that. And then we look at holidays coming up and Thanksgiving, and it may have to look a little different this year. Yeah. And a lot of people get their guards, they relax their guard, kind of let it down when it's someone you know. So you think that extended family from Denver, or from, Eastern Nebraska or something, we should be fine. I know them, they're not sick, they're going to come, we're going to be okay. And you get a larger group together, and that's kind of where we see a lot of the spread happening, is family get-togethers, where they think they, can feel comfortable around someone because they're related and they know them, they're not sick right now, they've been taking precautions, but really we have 48 hours before someone can have an onset of symptoms where they're contagious. And, they wouldn't want to come share that, but they may not know that they're going to get sick. And then we have those people that don't have symptoms, that never develop symptoms while they're sick. And so those are ones that we need to be concerned about. So think about Thanksgiving and what you can do maybe to keep it simpler this year.
Yeah. And I've seen some health professionals have started to post on social media about the surge of cases in Nebraska and the Panhandle. And so for most of all, what can we do as average citizens to help? And I'm hearing from you that's doing those preventative measures.
Right.
Wearing a mask.
Yeah, washing your hands, staying 6 feet apart, staying home if you're sick. And maybe really think, do I need to have this gathering? Do I need to go to this gathering?
Yeah.
And some of those are hard questions. And we know that, we're talking about weddings. We see a lot of spread happen at a wedding. Not just here, but across the state, you'll hear that as one of those things, because it's something that is special and you want to go to and be a part of. But, thinking about the size of the wedding right now, maybe you can celebrate with a reception later, or, just thinking about how we need to just take care of each other now. Sometimes grandparents may be invited to their, grandchild's wedding. I've heard this as a thing.
Yeah.
They aren't going to say no to that.
No.
And they're going to come.
No. Yes.
And then we've seen where that spread has happened, where, those people that are more prone to being sick are the ones that can't really say no. They don't feel like they can. They go, and then they've become very ill. So really thinking about what you're doing. Is it necessary? Is there some way that you can change it a little bit, postpone it, or make it smaller, a little bit more safer? And just taking that responsibility on ourselves as individuals, because that's the only way that we're really going to change this around in our community, is if we make it a community effort and take individual responsibility.
And you did talk some about the Thanksgiving, and the CDC said you don't have to cancel Thanksgiving, but you do need to think about celebrating it in a more safer manner, maybe not having the big family get-together that maybe has become a tradition. Some other measures to make it better, make it safer.
It might be this year that you have that within your bubble of family, which is your household, or that, when we talk about a bubble, You know, there's family that I take care of that I'm responsible for that's past maybe just my husband and I, but it's within my bubble of
Yeah.
people that I am with on a routine basis, and maybe you keep it to that level at this year, and then reach out by phone or virtual, or plan for a bigger event later when this is past, but knowing that you're doing that to keep everybody safe and really make a change in our community.
Does do health officials look at like events like that and expect that maybe in the weeks after there may be an increase in cases?
Yes, and we're seeing it from Halloween.
Yeah.
Where a lot of people got together in different forms, and we've seen it, with different events, throughout the year, when it's more, whether it's the 4th of July or, those that we see a kind of a surge with that. And right now we are at such a surge now that to think that, that we're going to have those holidays, which might make it even more so, the doubling time might lessen in the 15 days, and that's, the 15 days itself is scary.
Yeah, 2 weeks is already scary.
Yeah, like I said,
and then to turn into days, that would be
right.
It's awful.
Yeah, so that's what we want to prevent by talking about this.
Yeah.
And really, again, think about your individual responsibility and a community as a whole about really wanting to turn this around.
And a lot of the communities are planning holiday celebrations this year, or they're in that time period where they are. What would be your advice for best practices that they should implement if they're choosing to go forward with those?
We have a gathering document that you can go in and use on pphd.org that really gives you great ideas, and some of those are required to be submitted based on size. But even if they're not, it's a good tool to really help think about what you can do to make that event the safest as it can be. Anybody in contact with a big event, if you can wear a mask, spacing 6 feet apart, again, just putting those things in place and thinking about how you can apply that to that situation. And that's a really good form that you don't even have to submit if it's not if you have a venue that holds 500 and you don't have to be having 500 people, but if the venue holds 500, you need to submit a plan if you're going to be having something there. But if not, just encouraging people to maybe even use that tool, because you don't have to submit it, but just going through it really helps you think through those kinds of things about how to do it safely. Yeah.
Even my daughter owns a salon, and they had all the advice for salons, and so we just went right down through those and checked those, even though hers is a small salon, but we went through and there was a lot of things that we hadn't even maybe thought about, but it was like, okay, yeah, we need to put away the shampoos that are on the counter and stuff like that. So a lot of that documentation on the PPHD website is helpful in a variety of ways.
Right, and it's just helping people, think outside the box, because it's not the normal way of thinking, Getting together and sharing food and being close contact and hugging people, all those are things that we want to do and naturally do. So this is outside of our thinking, it's a different way. And it's something that, if you can have a tool to look at to kind of help you do that.
Yeah.
And that's part of that individual responsibility we really want to have people take on, is taking a look at what you're doing and really thinking about how to do it the safest way you can.
Yeah. And everybody will appreciate it.
Yes, very much. Especially if we can slow down that doubling rate and decrease those cases. Yes.
So do you have any last bits of closing advice you'd like to offer for the community?
I know that our community is one of those great communities where we want to work together and care for one another. And we've shown this in the past in many different ways. And now's the time to really step up and do it even more so.
Yes.
And one is to stop the spread by applying all these things we've talked about, taking the individual responsibility to do that. And then also just continue to show kindness in the community and being patient. I know as public health, we are overloaded right now and trying to get the contact tracing done in a timely manner like we've always done before. We're using this state resources right now, so some of those calls are coming from out of state. But we appreciate your patience and kindness to us as we're doing our job, and I think everybody else in the community needs to show that to one another also, because it really is a trying time and a challenging time for everybody. And if we can do that and be thankful and for our community and being those kinds of people and showing it to one another would be great.
Yeah, just a little bit of kindness can go a long way, especially right now. All right. Well, thanks for joining us on Table Talk, Paulette. And thanks also to our readers. And remember, this is a great time to say it. Just be safe right now. Thank you.
Thank you.